Hello, everyone. Welcome to our webinar on coping with the craziness of COVID-19 and resiliency and mental health. We're going to get started in just a minute. Hang with us. Okay, well, don't want to keep you all waiting. I hope you all are having the best day possible in the middle of all the stress and the craziness of COVID-19. Welcome to this webinar. My name is Tom Farley, and I work as a coach, and I am an experienced employee assistance program professional. Today, my intention is to talk about the stress, the coping skills that we all can develop and work on, and really share the experience of how we can focus on our self-care and take care of ourselves the best that we can in the middle of all of this. So again, welcome. Our objectives, what is the impact on our emotional well-being and our relationships? There's been so much change that's occurred so quickly, impacting our relationships, where we're working. Just the technology of attending a webinar is new for many of us. And what are some ways we can cope and really focus on our strengths to get through this time together? So much of this, as you can imagine, is about the attitude that we bring and the choices that we make. When you think about COVID-19, I think about how it feels like there's so much sometimes control over. So reminding myself that I do have choices during this difficult time, and I do have things that I have control over. So that's really what we're going to focus on, is what can we do, what steps can we take day by day to take care of ourselves, and so we can get through this and stay healthy, both mentally and physically, and keep our relationships the best that they can be, and manage stress. So much change that we're all learning to adapt to right now. So some things about attitude. We have natural reactions to significant change, changes in our job situations, changes in our finances, changes in our relationships, and isolation, spending all this time together, changes for our children, suddenly in new roles of being teachers at home. So with all that change, sometimes our first reaction is to kind of deny the severity and the difficulties that we are facing. And we can underestimate how significant the impact can be. And I think one of the more difficult things about COVID-19 is that it is going to last quite some time. So mentally, that challenges us in our resiliency and developing the skills to take care of ourselves. So recovery will take time. It's about being kind to ourselves, emotional first aid, and really relying on our known strengths and developing new strengths, developing new parts of ourselves in terms of coping that we didn't even know that we had, in terms of things that we can rely on to feel better. So what can you do to take care of your physical health? And what can you do to take care of your emotional and mental health during this time? I work as a coach, so my approach today is, my intention is, if you identify one skill, one activity, one step that you can take to feel better, to deal with what we all experience as anxiety and depression, or even anger and grief about the impact of this virus on our lives. It's about baby steps. It's about being patient with ourselves and developing an attitude of we can cope. We do have choices, and that we can feel better. We will get through this. So looking at the skills and the actions that we can take and how we can heal our psychological wounds from all of this, deal with the grief. Part of it is reaching out when you're lonely. You hear about so many people who are reaching out using technology, video chats, kind of like what we're doing right now, spending time together about this situation that we're all sharing. And being aware of the messages in terms of not getting down on ourselves. Sometimes when we have significant changes all at once, it can overwhelm us, and we sometimes turn that out of controlness on ourselves and blame ourselves, even though it doesn't make any sense. It's a natural reaction to these stressful events and changes that we're experiencing. So being aware, we'll talk a little bit about the messages that we give ourselves that can cause this situation to be even worse in terms of how we interpret it and how we're feeling about it. So protecting our own self-esteem, giving ourselves positive messages the best that we can, and battling negative thinking, some of the tapes that we may play that we may make this worse for ourselves by our own thoughts and our own negative thinking. So it's about, again, keeping our attitude as best we can. And what are some habits and behaviors that can help us be more resilient and can tap into our strengths in this process? So it's about emotional resilience. It's about optimism in the midst of real grief and difficulty and the challenges that this virus has brought. And I always like to think in terms of my own struggles or my own challenges, that although I may feel really anxious, I'm feeling the anxiety physically in my body, I'm carrying it around sometimes, I'm also have an opportunity to learn new ways of keeping myself healthy. So in the times of greatest stress and crisis, there's also an opportunity for learning and building new parts of myself and increasing my own awareness about me and my own knowledge about what works and what doesn't work. We all have learned ways of managing stress, or we can learn new ways of managing stress, in particular during this time, so that we can move beyond COVID-19 at some point and hopefully incorporate those new ways of coping into our lives, and we can be even more resilient and more skilled at taking care of ourselves as we go. So this is about being intentional. We're so focused right now on worrying about, especially if you're in a caregiving role, taking care of others, whether it's our parents or our children or our spouses or friends. So it really is about keeping the intention for my own self-care at the forefront. What can I do to manage the anxiety and feel better moment to moment, day to day as we go through this? So I mentioned attitude and our thoughts, how we interpret and label all of these experiences is really connected or correlated to our emotional stress. So it's kind of like our thoughts, the tapes that we play can cause us more stress as we go. So sometimes it's a matter of awareness, of being aware of how we may be increasing our anxiety through our own thoughts, and literally saying to ourselves, stop, and substitute positive, affirming, encouraging thoughts. Easier said than done, because our minds can sometimes feel like it takes control. So it's about being intentional again, and being aware of how we do start to be our own worst enemy in terms of the messages that we give ourselves. So the activating event here, this is a model of how our thoughts can be connected to our emotions, but we've all experienced this event, and our own belief system, our own values about what's important and what works in terms of keeping ourselves well really impacts how we end up managing our emotions as we're going through it. So these are just some stress building beliefs. You may recognize them. We were already challenged to manage stress in our lives before COVID-19. And so the beliefs that we have about ourselves, these are the messages that may cause us more stress, needing to be perfect. This is probably not the time to be perfect in all things in your life. If we just get through the day, you've seen that message maybe on Facebook or on the internet, that if we just get through the day, congratulations, you've accomplished something. So being realistic and not overwhelming ourselves by being perfect or having too high of expectations for ourselves, especially now, again, being kind and patient with ourselves and with others, or needing to meet other people's expectations. Sometimes we want to be supportive of each other, but we also can overwhelm ourselves with other people's trying to please what they're wanting from us, or what we call shoulds, being aware of our choices and our sense of control and what we want versus what we should do. When I should myself, I'm really putting a lot of pressure to do things, the have-tos, I should, as opposed to my choices. I want to emphasize language, the power of words, in my own talking to myself about what we're experiencing right now. It's natural, it's normal to feel anxious and stressed out right now. We're all human beings and going through natural reactions to stress. So other stress building beliefs, we sometimes generalize rather than, and we can, we deny something's going on, or we are imagining unrealistic results that really aren't based in reality. Or we can get into pessimistic thoughts where it builds on itself. We just have one negative thought, and then we can catastrophize to the point where we end up feeling even more stressed or anxious or depressed. So just be aware of the tapes that you play normally about situations, things that can cause you stress, and substitute positive, affirming thoughts as best you can. And we'll talk about some ways of doing that. So these are just some risk factors that we're all aware of connected to COVID-19, anxiety, again, for ourselves, as well as for others, safety and health. And the normal stresses and conflicts that we have in our family relationships, certainly compounded by isolation. We're all forced to be together in our homes right now. And so finding ways to slow conversations down and managing our conflict and keeping our relationships healthy, really a challenge right now. And for so many people, the worry about finances and job loss, putting all these together, worrying about mom or dad and how they're doing if they're high risk in terms of COVID-19, or caring for children at home, suddenly trying to do my job, maybe using the internet, and also thinking about childcare for my children or for my grandchildren. And just the loss of the normal things that work in terms of managing stress, being able to go to the gym, can't do that right now. Being able to connect with friends and having social activities face-to-face. So significant changes in so many different directions. That's why we're here talking today. And certainly if I've had recent losses or other significant life changes in relationships, I need to be extra special focused on taking care of myself and managing my stress. Because again, the more changes all at once, the more risk, the more I need to take care of myself and reach out for support and help. So I offer these slides not to cause depression, but just to be aware of risk factors. And with all of these that you see on this screen, you may be already aware of experiencing them on a short-term temporary basis, no big deal. What you want to do is be aware of if you are still experiencing these over a significant amount of time, especially after COVID-19, hopefully begins to recede and we get back to normal life, then those are signals, those are red flags that I need to do something for myself. I need to seek treatment. I need to call the Employee Assistance Program, and we'll talk about the EAP as a resource for you and your family at the conclusion of our time together today. So I feel, sad or anxious, and I'm having a hard time shaking that, or a loss of interest or pleasure in the things that bring me, that I have been involved in. Significant physical changes, weight gain or loss. So I don't want to read all of these. A sense of isolation, isn't that interesting? We're sort of we're all isolated together right now, but some of these are about physical, some of these are mental or emotional. The sense of helplessness and powerlessness that this thing called COVID-19 seems to be just everywhere in terms of our thoughts. We turn on the TV, again, remembering that we have control, that we have choices. If you leave today with one thing you're going to do to take care of yourself again, that helps to counter that sense of powerlessness. So what can you do? That's really what counts. Getting help, using the Employee Assistance Program that's available to you. There are telephonic options, there are video options, electronic options that you can take advantage of by using the EAP. In many communities across the nation, there are information and referral resources called 211 or other numbers that you can get support and talk to someone. There is help that's out there. Encouraging you to not go it alone and to seek support through the Employee Assistance Program or other resources in your community and we'll talk about the different kinds of problems, a reminder about what the EAP can support with. So this isolation in terms of relationships, it can lead to this, us directing the stress at each other in our conversations, or the lack of individual time to slow down. Sometimes we take that out on each other. So we encourage people to use what we call active listening skills to slow conversations down by recognizing when they're starting to feel out of control. If I'm in a difficult conversation, relationships and family relationships, my blood pressure is increasing, my heart rate's increasing. The very parts of my brain that are focused on listening well are being depleted of resources because I'm having a fight or flight response. With all of this anxiety, we're having this natural, normal fight or flight response. So we can develop skills, we can practice listening skills, especially now when we're thrown together in isolation and we're having maybe difficulties, and if things start to feel out of control. There is a real concern about domestic violence right now in terms of the impact of COVID-19, in terms of isolation and the increased frequency of domestic violence. So if you think about difficult conversations and conflict as the precursors to violence, and the more we can all use these skills to slow conversations down, focusing on listening, taking deep breaths, focusing on breathing, all important things that we can do, that we do have control over to try to prevent harm. So sometimes when we think about the impact of stress, It's really a safety issue in terms of our unclear thinking, or just having a hard time thinking, feeling stuck. What was I doing 5 minutes ago? Because the overwhelming, feeling of out of controlness, it's normal to feel a loss of concentration, or to have difficulty eating, lots of physical signs and symptoms. But this state of unclear thinking is normal. So there's nothing wrong with you if you find yourself with a loss of concentration, and letting others know as well as yourself that it's normal is just important in terms of, again, being kind to yourself. So other healthy lifestyle choices. This is really about where the rubber hits the road in terms of managing COVID-19. This is about taking care of yourself. So the normal stress management techniques, eating well. A lot of us are focusing on comfort food right now. So maybe that our choices aren't as positive as they might have been in the past, but making sure that we are eating well and focusing as best we can on healthy nutrition, food groups, etc. Exercise. We can still exercise either within our homes, when we're isolated, finding new routines, making it a priority. So many of these choices are about putting yourself first. And again, baby steps. Maybe I'm going to go for one walk for 20 minutes today, and tomorrow I will go for 25 minutes. So sometimes we overwhelm ourselves with too many expectations and actually cause ourselves more stress. So being intentional, but also being realistic about what we expect from ourselves. But starting some kind of exercise routine, or deciding to go for a walk, especially if I'm feeling a lot of anxiety, if I'm having difficulty sleeping, paying attention to routines that will help me be more ready for sleep, and practicing relaxation techniques. So breathing is so important, slowing myself down, being aware of the anxiety in my body, and then intentionally letting go of my anxiety. So if I'm having a hard time sleeping, maybe I can practice new techniques or new ways of breathing and relaxing the stress that I'm carrying around. It's kind of a process of me being aware of it first, and then taking a deep breath, and then letting go of my stress or letting go of my tension. And I can get better and better at that. This is something that you can practice and improve on. So phone calls, video chat with the grandchildren or with other family members far away, being as supportive as we can be, as we can with each other. I was very heartened yesterday to just observe lots of family members practicing social distancing, but neighbors and family members all connecting with each other in ways that I had not seen in other situations. So we can be supportive in relationships and making connections. I see people doing that. Those are really positive outcomes from this crisis that we're all going through. But exploring, supporting, and making the choice to reach out to others and family and friends as best we can. Planning for quiet time. So important just to slow myself down. Really hard to do when we're all isolated together. So whatever works in terms of quieting yourself, whether it's, some people call it just moments of silence or meditation or prayer, whatever fits into your own value system, but blocking out a specific time to be quiet, to turn off the TV and the phone, and to really be aware of how this whole situation with COVID-19 is impacting you. I can't let go of stress until I sort of become aware of how it's impacting me. So it's almost like tuning into it before I'm aware of my own power of choice to let go of the tension and the anxiety. So I mentioned a little bit about communication skills. If you put in active listening in Google, you'll see lots of tips about ways of slowing down conversations when things are stressful. And so really encourage people to explore that, especially if they're concerned about how stress is impacting relationships during isolation, or just improving my communication skills during this difficult time. So, so many of us are observing the best coming out in people in terms of kindness, in terms of doing good deeds for others. It feels good, it has value, it's important that we are all in this together and that we're all supporting each other. So it also helps me feel better to do for others in this time of need and challenge. And then learning or trying something new. So what one thing can you do that's new for you during this difficult time that will be of value to you a year from now? Whether it's a new hobby or a new book that you read or a new skill that you develop. Maybe you've never tried meditation or yoga, and this would be a great time to add something to your life that can help you feel better. So I really like to emphasize the things that you can control in the middle of what feels like a lot of out of controlness. Again, sort of a summary, you can control how you think and interpret things. It's about being aware of, again, the negative messages and beliefs that can get in the way. You can decide what's important and what's not so important right now. Crisis and significant challenge and grief gives us a real reminder about what's important in our lives, what really matters. And so being aware of prioritizing right now in particular, what's important to you, what's going to really matter in the long run, and how you communicate and deal with conflict. The best of ourselves can come to the surface, and the worst of ourselves can come to the surface in terms of our communication. So we all have blind spots. We all have styles under stress in terms of our relationships, in terms of our communication that come to the surface that can make it more difficult. So being aware of how you deal with conflict and being intentional about skills and practicing those when things get difficult. How you take care of your body. Again, nutrition, exercise, sleep, the traditional things that we use to stay strong and manage stress, and new things that we can add. The last one, sometimes we're carrying all this emotion around and we're not giving ourselves time to feel what we need to feel. Again, that's about taking the time, giving ourselves permission to laugh. Humor is a great resource. It's a great strength in the middle of such difficulties. Maybe I need to have a good cry and release this tension. You know, how do I feel right before I have a good cry? I feel kind of stressed out and kind of like feeling out of control. And so after I give myself time to feel what I need to feel or to experience normal, natural grief, I feel better. I feel more of a sense of peace and more of a release of that which I've been holding back or not allowing myself to feel. So I hope that makes sense to a lot of people, but again, giving yourself the time in this space and just slowing yourself down enough to feel what's normal and natural in being a human being. So again, more skills, again, redirecting thoughts and actions, really focusing on what can I control today, what can I do? There's lots of things beyond that feel out of control, but I can control some things. Relaxation exercises, breathing, They can be very simple 1-minute exercises where I'm just aware of where I'm carrying my tension, and I breathe and I consciously, intentionally let go. And I can get better and better at it. So again, you can learn more about relaxation exercises on the internet. The whole issue of mindfulness. If you put in what is mindfulness in Google, it's about really being aware of not worrying about the past and trying not to worry in the middle of COVID-19. Easy to say, hard to do. Not worrying so much about the future, but being in the present moment. So we berate ourselves, we overwhelm ourselves with thoughts again, and that can cause even more stress beyond our current circumstances, which are challenging enough. So slowing our thoughts down, it's a skill. Again, what is mindfulness? Put it into Google. There are lots of techniques that you can use to be aware of how we can cause ourselves stress, and we can do the opposite. So again, being kind to yourself, doing things that can help restore a sense of control and putting energy into those things, in being intentional about it. Maybe 1 or 2 things each day. Again, baby steps. Don't overwhelm ourselves with too much expectations. So focusing on thoughts as best we can, exercising, breathing, yoga. If you haven't done that in a while, now's the time. Maybe you can renew those techniques in your life. Sometimes we let go of the things that used to work, maybe when we're even children and when we become adults. So you can learn new exercises and techniques to release anxiety. And again, finding hobbies. It's all about attitude, and being aware of what we do have to be grateful for helps me slow down and appreciate what's important and what I have control over. So practicing gratitude, just being aware of what helps me feel better. So my intention today was to offer you some ideas, some suggestions. It's really about a call to action. What can we do right now when it feels like there's so much challenges that we have that is beyond our control? So being a model for others in terms of either communication skills or kindness. So many of us are challenged with responding to children in terms of normal parenting, but now we're being asked to be teachers. So I guess experiencing this as an opportunity to offer new ways of ways of encouraging learning in relationships and in communications and in managing stress. So if children see us doing new things to manage stress and feeling in control, that's a positive message for them. I really want to emphasize the availability of the Employee Assistance Program. Confidentiality is so important. You don't have to tell anyone. You pick up the phone and call. Counselors are available to sort through the emotional impact, the financial impact, the significant legal issues that may come up as a result of COVID-19. So we encourage you to call the Employee Assistance Program. There's another slide that I'm going to show that's a summary of all the different issues and concerns that the EAP can respond to. Your employer has paid for these resources. Really encourage you to not go it alone and to seek support and treatment for issues, especially if you're starting to see some of the red flags that we talked about earlier over a significant period of time. So either for prevention or for treatment and intervention, please take advantage of the EAP if you would benefit from doing so. It's a sign of strength. It's a sign of courage. It's a sign of being smart enough to take care of yourself. It's an attitude of wellness during this difficult time. Again, as a coach, I think about what one or two things you can do and set some goals for yourself, and feel that sense of control in terms of something that you can attain for your own self-care. So final message today, if all you did is hold it together, I'm proud of you. So sometimes all we're doing right now is getting by in terms of coping. It's about incremental steps that we can take to manage the situation. And it's not about doing it all in one day. So be kind and have realistic expectations about it's okay to be a human being, I guess is the message. So here's a summary of the EAP program again, in terms of COVID-19 may impact, certainly in terms of loss and grief, but also for many of us, family relationships, just needing someone to talk to, emotional support, concerns about substance abuse. We want to be aware of the risk factors of relying on substances or other addictions to relieve stress rather than some of the proactive, positive, healthy self-care steps that we talked about today. So please utilize the Employee Assistance Program. The EAP website will have registration for additional webinars over the coming weeks and months. And we encourage you to join the conversation and again, focus on your self-care and do the best you can in terms of taking care of yourself as we all share this experience. Hope you have a great rest of your day, and thank you so much for joining us today for this webinar.